Hello, Africa. Hello, teenagers. Thank you for joining in today. So today I have a clinical psychologist in the house from UCH, that's University College Hospital in Ibadan, and he's here to talk on psychotherapy and how it can help one overcome addiction. Now, I'll just go over to him. When we checked on my Instagram page, you realize that I always share that one of the ways out of addiction is going through therapy. You need therapy. You need to talk to somebody that is trained to walk you through the process. So today I brought somebody that is trained to come share with us how therapy works. And come on, a lot of us think therapy is so expensive. I don't have the money. I cannot just put my child there. Or I don't even need it. All I need is prayers. Yes, prayers work immensely. But alongside that, you also need somebody that is trained to walk your child or even walk you through the process of overcoming addiction. So I'll go to my guest today. His name is Damola Ilesanmi. Damola, welcome. Thank you so much.
Good morning, everyone.
So yes, I would like to really ask you about therapy and how it works.
I'm glad you mentioned therapy because there are different types of therapy. The more clinical one is the psychotherapy, and there are other forms of therapy. We have dance therapy, we have music therapy, we have arts therapy, we have meditation therapy. But for the sake of addiction, I think we're talking more primarily about psychotherapy. Psychotherapy actually is a broad band type of psychological interventions that aims at the treatment of addictions. Again, there are also different types of addictions. So, um, different versions of psychotherapy applicable to different types of addiction.
Thank you. So I would like to ask about you said that there's kind of a therapy applicable to the kind of addiction. So let's imagine that somebody battling with substance addiction. How would you intervene in that kind of situation? Let's imagine that a child and the mother has brought to you to help with overcoming sugar addiction. So what kind of help would you prefer as a specialist?
First, when it comes to substance addiction, what we call the substance use disorders, it's also a sub broad type of addiction because it has different types of subclinical diagnosis. For example, under substance use disorders, we have alcohol dependency syndrome, we have opioid dependency, we have nicotine or cannabis dependency, or just the abuse. You know, that there are stages. The severity is what actually matters. Now, the kind of psychotherapy that um, works for such has to do with presentation. For example, let's say the scenario: a child comes in, has a substance problem, maybe cannabis, come up with cigarette use, and the child needs help. And the first thing is to talk about the child, understand the child from his own perspective, from his own perspective, and first thing you do is an assessment. You want to know if that child understands that it's a problem. You want to know if that child is ready to change. You want to know if that child is motivated enough. And for those assessments, you then build willingness to change, motivation, stuff like that. Before they are also part of therapy, yes, but before the therapy itself commences, those are the criteria that the child has to fulfill before the treatment program.
Okay, thank you very much. And medically, there's some support groups that help people like that.
Yes,
And it's a
yes.
bit confidential because I know that a lot of people will know what students support group because they feel like, okay, so that this guy in my group and then they can put me on
No, no,
WhatsApp
no, no,
and
no, no, no.
everybody knows
We
that I
have
actually use it.
we have support groups. We have anonymous support groups. But that's like discussing a stage that's like a century away. There are a lot of stages that has to be passed before we get to that support group. For example, some people actually get to the wind of addiction, without being admitted into a facility. For some people, the dependency is just so high that they cannot just do without. But the beauty of being admitted or being held at a facility is that you get to have more time to yourself to actually introspect, have the full effect of the therapy itself, because the condition of the environment does not just affect um, these changes, it influences your perception about the world, your environment, how you see things. For example, the famous kind of, but one of the most commonly used psychotherapy is what we call the cognitive behavioral therapy. It addresses both the cognitive aspect and the behavioral aspect. But again, because they are linked together, we tend to call them together. But the truth is, they are function independently and also function lovingly. Now, let's assume that a client or a child, is ready to stop, understands these things. As session progresses, there are different steps, there are different modules in psychotherapy that equips that person to understand where he's coming from, what it has cost, both directly and indirectly, where the person might end up, how the person can get out, how the person will stay out. Now, there are practices, there are exposure mechanisms, a lot of things that go into place to ensure that the way the mind thinks is different. Remember that addiction is not just about not being able to stop, it's because there's an alteration in what we call the organic pathway of the brain. So it's like the reward center of the brain, So it has to do with routing your metaphysician, your process, your thought pattern basically, to influence the behavioral change that we're talking about. Of course, your personality is another factor. So summarily, yes, we have um, anonymous groups, but it's like the last thing that comes after treatment or full recovery is managed.
Yes. Now, you made mention of something about the fact that your temperament type has a lot to do with it, and then other factors too has a lot to do with you overcoming addiction. Now, my question here is, how many months does it typically take a person to overcome addiction? Now, we know that there are some people that are melancholy in nature, some are sanguine, they're always there, coming life of the party, some are just know the choleric now and then phlegmatic. So, how many months can the different temperament types, how many months can it take for a typical teenager to overcome addiction? Fully. Some say that you relax, you go there and come out, you go back and forth and all of that. Then, so secondly, I'll ask that. Is it everybody that goes in and out, in and out? Then how many months does it take?
Well, there is no time specific, but yes, there is a time range. But I listen to my clients. Overcoming addiction just takes less than a minute, perhaps a second. Just decide. Now, what we do is not to get to stop. What we do is, for example, the psychiatrist will start with medications to help you set the brain, the body, reduce the craving, the addiction, to detoxify, right? So we give you drugs that will inhibit the ability to be open, to be off that substance. And that's just that. Sometimes they attempt to use psychotherapy to actually stay off. Now, when the psychologist is being consulted, the idea is to make you understand what it is, how it started. Sometimes, but most times, people don't get to be able to pinpoint how they got there to start with. So, if we're talking about treatment in a sense, it's beyond what we're talking about. So, your temperament, your personality does not count. Um, Substance addiction basically is no respect of age, ethnicity, religious belief, age, personality type, socioeconomic status. It doesn't care. I mean, you are human, and that's enough. And as a matter of fact, you don't even have to be human. As long as you're a living thing, it's enough. I mean, rats, when we do experiments on animals, we observe these behaviors. That's their response to these substances or to different addictions. So, yes, temperament or let's say personality is a factor that can influence. I agree, that can predispose. I agree, I can protect. I also agree. But in determining the time frame, no.
So, technically, it's possible that the child comes out of this maybe a week, 2 weeks, 1 month.
Okay, so I'll let you elaborate on that. When I said perhaps a second, I was talking about your determination, your
How
motivation.
desperate you have to
Yes. Now, psychotherapy helps to understand where you're coming from. helps you understand why you are the way you are, why you are where you are right now, how to control it, understanding how it works. Imagine you um, being on a train, maybe a speed train, for example, and then it just goes off, or a plane, for example, and it takes off. You know deep down that there's someone there, guiding it. You're not thinking of what if it goes, maybe and then the flight gets exhausted. What would happen to me? Now that's psychotherapy. It makes you understand the mechanism of addiction, the mechanism of rehabilitation. So stopping is a mindset, but the treatment itself is what helps you to not go back into it. Now for those who relapse, yes, relapse happens. Agreed. There's something we call relapse training. Yes. Now, relapse does not mean it's the end. It's not expected, but when it does, I expect for that.
Thank you very much. So, now you said a lot already, and from my research on addiction and listening to people and all of that, I always feel like there's a relationship between addiction and mental health. And from the things you said, it looks like you both do, and I do somewhere. Can you elaborate? Now, amazingly, when we say mental health, we always make it look like people that have mental issues. So, I know mental health has to do with a lot of issues.
Yes.
So, you don't have some psychology, it's your own kind of issue. So, how does that work with? So, when you're telling a parent that, oh, this thing has some mental health background to this child,
Yes.
how can we broaden it to parents to understand when we say mental health has to do with the addiction of the child?
Well, I would say that for addiction to occur, there must be a background sort of mental illness. Now, mental illness does not mean what you're thinking, like say psychosis or schizophrenia. It's not limited to that. The truth is, for those who actually have what we call the road rage, very common, who have anger issues, it's a mental health issue. To those, there is food addiction. People just can't stop eating. It's a mental health condition. People who have high temperament, it's a mental health condition. But because we just classify that man who has no restriction of time and place and event, who does what works and messed up, that's a madman there, that is mental illness. There is more to it. Now talking about addiction. Addiction is the illness. And remember, it's illness, mental health is not basically an optimum thing. It's just saying it's an absence of something, right? So we're talking about mental health and addiction. Addiction itself is the problem. Addiction is the point and the trigger, the point that tells you that there's an illness. Why do people get addicted to things? You want to escape from something in reality. You want to cope better with something. You feel you need something to do other things. Work open skills. And these are things that we call false thinking pattern. Now that false thinking pattern itself is an anomaly, and that's a mental illness. I think that summarizes
Yes,
this.
that really does summarize. And you really said a lot today. Now, let's look at usage, for instance. So, just looking at how much, what's the monetary involvement? A parent or even a person just feel, oh, I need this therapy, I want to accomplish this thing. Sometimes, like I said earlier, money is what pulls them away. This is much. So, what's like the monetary involvement? This is something that is really capital intensive. You must have like some 200,000 in your account. You must have like some huge money, and then you register, and then first put the money there, and done before your therapy is done, and things like that.
Well, there are two sides to it. In the university college hospital, it's a federal tertiary teaching hospital. So a lot of things are very subsidized, trust me, very subsidized. And then some parts where it seems like we do not have facilities. We have PPP, so basically we have everything that we need. Now talking about the finances, we tend to talk about the financial effect because it's mental illness. It's unlike a biological illness in the sense that it will be malaria, a spinal cord injury, or a gynecological problem, or burns, or trauma. When we talk about money, you just want to get better. But when it comes to mental health, because it does not kill directly, we did talk about the money. I do not think it's expensive compared to private practice because it's highly subsidized. Now, how do you access it? What we do is you can actually walk in, all right? What we prefer the most is you coming through the general patient, call it the GOP. There you will see by the doctors. They can rule out every other medical necessity or highlight it as a case, and then refer to us. But if you say you don't have any medical condition, why not? You just walk in. But we usually prefer that we rule out all medical conditions just to offer optimum coverage. Currently in this stage, payment is by 6%, and I don't think it's that expensive. Less than, for example, the first time, less than say, I think 5,000 naira, you might be able to get to see us, and that involves the cost of opening the case notes and paying for your session. It's not a consultancy fee. Subsequently, it's not up to that as at now, alright? As at now, but yeah, it's actually very affordable.
Okay. Thank you very much. So I think we talked actually okay as really what talk about as regards therapy and then how we can really help teenagers and everyone alike. Like I keep mentioning teenagers because like I always say this is towards teenagers, but then parents, whoever it is, whatever age bracket you are, therapy can really work for you and help you in overcoming addiction and whatever it is you go through. One thing I really want people to understand today is you need to speak to somebody. You need to talk to somebody. And you know this medical doctors, clinical psychologists, they don't know you. They see you as just a patient. So trust me, nobody's going to go about telling your story to the next person because these people don't know you. And you're probably one of the 1,000 of patients they've treated in this having the same issue. So it seems like I want to say something.
Yes. I think the first thing that we usually like to establish is what we call the patient confidentiality clause. Like I usually tell my clients that I'm the shrink. You could tell me everything in this world. Things you can never tell your God. In case he wants to kill you, you can tell me you're safe. But what we discuss stays within. If you are a minor, there are conditions to that. Even if you're an adult, what would make me avoid what we talk about at my discretion is one, it is relevant to your clinical treatment to help you. Two, if it's mandated by the judge, maybe justice, in relation to a particular maybe event. Beyond that, we will discuss, stays. Now, I would like to also say that we have different specialties. Basically, we have the forensic, we have the child and adolescent unit, we have the adult and the substance. So I don't want it to seem like all they do is just addiction. So if you have other problems, even beyond addiction, or you think led into addiction, please come.
Yes, so he has given you the open invitation. And now it's not just talking because he works at this stage. Wherever you are, just walk into an hospital and then speak with them on whatever it is you are going through. Like I said, there's a confidentiality clause. Nobody is going to tell your story to anybody. But the truth is, you need to speak with somebody. You need to talk to somebody. You need to get somebody involved in what you are going through. That way you can be sure that you are fine. And that way you can be sure that treatment is just on the way for you. So thank you very much for joining. Thank you so much, Damola.
Thank you.
Thank you very much. Bye.